Let us discuss role of beta blockers in HF. Although it may seem counterintuitive to administer drugs with negative inotropic activity in HF, evidence clearly demonstrates improved systolic functioning and reverse cardiac remodeling in patients receiving beta blockers. These benefits arise despite an occasional initial exacerbation of symptoms. The benefit of beta blockers is attributed, in part, to their ability to prevent the changes that occur because of chronic activation of the sympathetic nervous system. These agents decrease heart rate and inhibit release of renin in the kidneys. In addition, beta blockers prevent the deleterious effects of norepinephrine on the cardiac muscle fibers, decreasing remodeling, hypertrophy, and cell death. 3 beta blockers have shown benefit in HF: bisoprolol, carvedilol, and long-acting metoprolol succinate. Carvedilol is a non-selective beta-adrenoreceptor antagonist that also blocks alpha-adrenoreceptors, whereas bisoprolol and metoprolol succinate are beta-1 selective antagonists. Beta blockade is recommended for all patients with chronic, stable HF. Bisoprolol, carvedilol, and metoprolol succinate reduce morbidity and mortality associated with HF-rEF. Treatment should be started at low doses and gradually titrated to target doses based on patient tolerance and vital signs. Both carvedilol and metoprolol are metabolized by the cytochrome P452D6 isoenzyme, and inhibitors of this metabolic pathway may increase levels of these drugs and increase the risk of adverse effects. In addition, carvedilol is a substrate of P-glycoprotein. Increased effects of carvedilol may occur if it is co-administered with glycoprotein inhibitors. Beta blockers should also be used with caution with other drugs that slow AV conduction, such as amiodarone, verapamil, and diltiazem. While we are at it, let me tell you a super easy mnemonic to memorize contraindications of beta blockers. It's ABCDE, where A for asthma, B for heart block, C for chronic obstructive pulmonary disease, D for diabetes mellitus, and E for electrolyte imbalance, for an example, hyperkalemia.